All right, now we are going to look at if you've come to the hospital, the doctor has your obstetrician, your gynecologist, or your doctor has found that your pressure is a bit high. Of course, chances are high they will send you to do a scan, they will send you to check your urine, and they ask you whether you have a headache or you have pain in your stomach, or you are not seeing very well, because as we've said, those are signs of organ damage because of the pressure. What are the chances, or what next? Okay, and preeclampsia, which we say the blood pressure of 160 over 110, or a pressure above 140 over 90, but with things like protein in your urine, headache. Okay, that's already preeclampsia, the second level of pregnancy-related pressure. It's a problem that we know that as pregnancy keeps growing, it is also going to keep growing. You get it? That once the pressure comes in, because the pressure is being brought by the pregnancy itself, so as the pregnancy keeps growing, also the pressure will keep worsening, and that's the biggest fear. Okay, so when you come to the hospital, the doctor finds that you are hypertensive or you have preeclampsia. What next? So number one, we want to know that if this pressure is high, what organs are damaged? Okay, so the doctor may look at your liver, because that's one of the organs which are severely affected. The doctor will look at your kidneys, okay, because we know pressure damages kidneys. The doctor will do a scan to assess the baby, because if the problem is affecting the sac where the baby is eating from, the baby's bag, chances are high they're not getting enough nutrients, they're not getting enough oxygen from the mother, so their growth is going to be retarded. Okay, so you look at this mother, she's 20 weeks, she comes in with all these features, you do a scan, you find that the baby is not growing well, the baby is smaller than 20 weeks. Then you know that even when we prolong this pregnancy, the prognosis or the outcome sometimes is not very desirable. So what do we want to do? Number one, we want to prevent in the first place. So when you find a woman who has a risk factor for developing pressure-related complications in pregnancy, first of all, prevent, because we know once it comes in, it is a roller coaster. We can say it's a roller coaster. It will keep bringing in one problem at a time. But then, what can give us the good chances of outcome is related to the age of the pregnancy, such that if this pressure comes in when the mother is still below 26 or 28 weeks, sometimes we're a bit worried, because we know that we are still very young, okay? And so the outcome may not be as desirable as we would have wanted. But then when the pressure comes in above 28 weeks, that's a bit better, because now the baby is older, that even if we are to deliver the baby early, it will still be able to, to make it. And so the older the pregnancy before the onset of this pressure, the better the outcome. Whereas the younger the pregnancy, usually the outcome is not the desirable one. Okay, and you find many mothers, they say, doctor, can't we wait? Because usually this is an issue of mother and baby. Should we save the mother? Should we save the baby? Okay, because we know that if both remain in combination, the mother keeps the pregnancy, then problems will keep coming. The pressure will keep going higher, and the organ damage will keep going on. Okay, and so you find that story is a dilemma, and for most mothers, the unfortunate side is always to make that difficult decision. But then when we are 28 weeks, 32 weeks, 37 weeks, if you're 37 weeks, the baby is already grown, we can deliver the baby. So the prognosis or the outcome of pregnancy, which is facing pressure problems, depends very much on the age of the pregnancy, or the weeks of the pregnancy, or the months of pregnancy. The more the months, okay, you are 7 months, you are 8 months, you're 9 months, the outcome is better. 6 months, 5 months, usually the outcome, we are worried that even the longer we take, the more we put the mother's life at a risk. Now, how do we prevent pressure in pregnancy? How do you prevent? Of course, like all the health problems, prevention is the most important. Number one, if you know that you're at a risk, you know your last pregnancy, you had pressure, when you get pregnant, come early in the hospital, okay? Come early in the hospital so that you are attended to and followed up right from the start of your journey of pregnancy. If you are already hypertensive, okay, and you get pregnant, you come early, okay? You have twin pregnancy, you do a scan in your first trimester or the first 3 months of your pregnancy, they say there are twins in there, then you want to really be closely monitored because we know that twin pregnancy or multiple pregnancy is a risk factor for pressure in pregnancy. Or if you have a close relative, you know, a close relative who has pressure, or your mother had pressure issues in pregnancy, then you also want to come early. If you have extra size, okay, you're a bit heavy and you get pregnant, you are diabetic, those are conditions that we know if you have them, they will put you at a higher risk of getting pregnant. Also, when you are older, you are more than 40 years, you are younger, 20 years of age and below, and you get pregnant, very important risk factor. So, of course, what will the doctor do for you when you get when you are at a very high risk of getting pressure? A lot of research has been done on this, and you find that the doctor may put you on some drugs that increase the chances or reduce the chances of you not developing pressure of pregnancy. And you know, a doctor may put you on aspirin if you've gone through that before. Your doctor may give you some aspirin. You know, these days they can even give you some antioxidants, fruits, which have a lot of vitamin E, vitamin C. You know, those studies are ongoing to show that even just fruit consumption, which has a lot of vitamin C, vitamin E, which are very good sources of antioxidants, can improve or can prevent pressure in pregnancy, and several other drugs, which I may not be able to share here today. All in a nutshell, pressure in pregnancy is a very real challenge for pregnant women, and many mothers are losing lives because of it. That's why in the medical world, especially in the obstetrics and gynecology practice, we are very, very keen. We are always on the lookout to ensure that our mothers don't get it, but if they get it, we handle it as early as possible to save or to give a very good chance for both the mother and the baby. So thank you for listening to me. We meet again next time.